topic because there's still no real clear answer for everybody when to implant a pacemaker in patients with complete heart block after cardiac surgery. So maybe I would like to ask the moderators, the chairpersons here, Irakli, when do you implant a pacemaker after cardiac surgery when they get a complete heart block? After 3 days, 5 days, 7 days, 2 weeks, or what is this? What is your consensus in your center? Never?
Never.
No pacemaker, even complete heart block?
It's mainly depends on AV block after the operation. If it's fully and we don't see any connection, then after 3 days maybe. But if we see some kind of conduction, we waiting every time 7 days.
Okay, so 3 to 7 days.
Yes.
Okay, what about you, Dr. Dick?
I will wait 1 week.
1 week.
1 week.
What about you, Ryan?
Is from my team, but I would like to 10 days.
10 days. Okay. Yeah.
About.
What about you, Kurt? Around a week. Yeah, most centers or most consensus is about 5 to 7 days, like we see in many recommendations, and there are several things to consider, like infection, also nosocomial infection, the longer the patient stays in the hospital, and or the immobility of the patients, the longer they are stay immobile. So that's why I wanted to talk a little bit about this in this forum. So we all know about AV node. We don't need to go too deeply into this. We know about complete heart block. Yeah. So what I'm talking about is really about complete heart block after cardiac surgery, and it is a post-operative complication, usually due to the ischemic injury after cardiac surgery, or it is a major source of mortality, morbidity, and of course a financial burden, since the length of stay is prolonged, and it requires permanent pacing after cardiac surgery, and it is most likely happened after valve surgery in most cases, in several instances now even after TAVR, and aortic valve, tricuspid valve, mitral valve repairs, or a combination, very rare after coronary artery bypass grafting. It's usually, if it is CABG, it's usually degenerative of nature, and usually manipulation of injury close to the compact AV node and the AV conduction axis. Direct trauma like excision, debridement, prosthesis impingement, stitching, tissue remodeling like edema, hemorrhage, and exacerbation of pre-existing conduction disease. This is usually, if it is a pre-existing conduction disease, usually found in patients who are older, and in most pacemaker implantation after cardiac surgery happens in less than 1% after bypass grafting, but it could be go up to 5% after valve surgery. So these are the preoperative and intraoperative and postoperative risk factors. Usually age is one of the main risk factor. The older the patients, the higher the risk of problems with the AV node, which may be contributed to the operation itself, but also maybe the patient itself has a underlying problem with the AV node. And other intraoperative and postoperative risk factors. These are the risk factors, comorbidities, which are here. I don't want to go deep into these, but there are also other, like a renal failure and abnormal HCG, of course, is just logic that if they have already a pre-existing conduction system disease, the higher the risk of getting a more advanced AV block after operation. In the pediatric population, of course, it's also increased, especially in the AVSD and the ASO or ASD or VSD operation and VSD operation have increased incidence of AV block, of course, the Glen and Fontaine as well. And these are the recommendations which many follow. Sorry. Here, after 5 to 7 days, if the AV block is not resolved, so like like the chairpersons and other faculty members, except Ryan, who is implants then after 10 days. Yeah. So I would like to show also the ESC guidelines, also 7 days about, and there are some data about steroid use to yeah, this is also I would like to ask, and my colleagues here, anybody uses steroids after post-operation? No? Because of the inflammation? Anyone with experience with steroids?
For AV block, no, we used some 5 years ago. After 3 years ago, there was new studies which shown that there was not big benefit of steroid use.
Yeah. Yeah, there's actually a study from Gotzi who showed that that may be quite effective using dexamethasone, which my center tried to copy, but yeah, this is my center, National Cardiovascular Center, Harapan Kita. This is our data on cardiac surgery. We have a lot cardiac surgery and about 10 to 15 AV blocks a year post-operatively. This is the adult surgery, yeah. And most of the surgery are valve related. If you can see, mitral valve and tricuspid valve has a 7.9% of AV block here, or aortic valve and mitral valve 6.7%. So valve surgery. So here we can see that this is the total AV block in the adult surgery department, heart surgery. So, and here's our data when they convert or when the AV node resolved. So we can see if it is less than 7 days, 47% of the patients resolve actually the AV block. But if we wait a little bit longer, then there are another 17 patients of those who have total AV block who resolve their AV block. And more than 14 days, there's still another 8% who will resolve their AV block, and 28% in the adult population will never recover from we see at the pacemaker data. So they are still dependent. So from the 30% here, they are almost they will never recover. So these are the types of surgery. Of course, valve surgery is the most in our data have the most risk for total AV block post-operative. And this is our pediatric population where we see similar, about 30% will never gain conduction in their AV block. But if you see here, about almost 70% will actually get conduction again in their AV node. So if we no 31% who will never get, but the rest is almost 70% who had AV block post-operative but then gained AV node conduction again. So so if we only wait for 7 days, there will be a lot of them who will have a pacemaker, but later on have AV node conduction. That's also for the adult population. If we only wait 7 days, yeah, like the consensus for in many hospitals, then actually there's still about 25% if we wait until 20%, if we wait maybe until 2 weeks, that's why we have changed our protocol in our hospital. We will wait until 14 days. Yeah. Since the patients usually have the pacemaker here, they can still get mobilized. They have the wires sticking out of the chest, but they can still mobilize. Of course, the cost is of length of stay is longer, but still mobilization is possible as long as the pacemaker wires are stable and the patient can be paced. And this is our data with methylprednisolone, not dexamethasone, where we compared patients with steroids or not steroids. There's no difference in our data. Of course, our patients' data is only, the sample size is only small, but we did not see as well any benefit of steroid use. We do not recommend steroid, so just wait and see. And our conclusion is, ladies and gentlemen, the rate of pacemaker implantation is procedure specific. Usually the valve procedures is the risk of AV block higher, and the conduction disturbance risk requiring pacemaker after cardiac surgery include those combined with mitral and tricuspid or aortic valve replacement are the highest. Our own data showed that steroid therapy has no impact on the difference of AV node conduction postoperatively and should not probably be given, since there's also a risk of infection due to the reduced immune response afterwards. So the last conclusion would be, in our center, we then wait for 14 days now. And because we see a lot of patients who come back who have already a pacemaker, but the AV conduction is normal if we put it in after 7 days. Thank you for your attention.